Hi, everybody. Welcome to podcast number 3 for chapter 7. And today we're going to be taking a look at the different structures that make up the skeleton of the human body. So there's a lot of different bones. Remember, there's 206 bones in an adult. And we're going to kind of look at them in groups. You're not going to have to know every single one of those 206, but we're going to take a look at a whole bunch of them. And we're going to look at them in groups. So we'll look at the ones at the skull, your thoracic cage, your vertebral column. We'll take a look at your pectoral girdle, as well as your pelvic girdle, and then your arms and your legs. So we're going to start with the skull. The skull is made up of 8 different bones that are fused together and that work together in order to protect your brain. Very, very important job, obviously, because without your brain, nothing would work. Each of these bones are actually large, flat bones, and they are all connected together by sutures. This is actually a type of joint that will fuse the bones together and make them a solid structure. So while your skull is one solid structure, it's actually many different bones that are fused together. Now, in a fetus, you can actually feel soft spots. Those are the fontanelles that are in a fetus, and that is because those bones have not fully grown yet, and they are not all fused together. And a lot of times that main soft spot on the top will not completely fuse until sometimes as old as the age of 5. Now, there's also a large opening at the bottom called the foramen magnum, and that is where the spinal cord is going to connect to the brain so that your brain can communicate with your spinal cord, and then your spinal cord will communicate with the rest of your body. So if we take a look at the major bones of the skull, I'm going to circle the bones, the names that you need to know, and you want to make sure you circle those on your notes as well. So the very front bone is your frontal bone. Makes sense. That's your forehead. The back is your parietal. That's the back of your skull. Low down on the bottom, near where your spinal cord is going to connect, is your occipital bone. And then your temporal bone is over here on the side. And you can think of that where your temples are. A lot of people talk about those. Your mandible is your jawbone. And that's here on a hinge that can move up and down. So this skull is a young person's skull, and you can see that because they're actually the fontanelles. This is the large soft spot that we often can feel in a child or an infant. I remember when my sister was younger and she used to fight with me. She's 2.5 years older than me. She actually stuck a pencil into my soft spot before it was completely fused. I'm okay, mostly, but not a nice thing to do. But as we get older, the bones will continue to grow until they are completely fused. So forensic scientists can actually find a skull, and they can estimate the age of the person when they died based on how closely together those sutures are. So they can tell if they were a child or an adult, and sometimes they get a pretty close approximation to their age. So if you take all of the bones that protect just the brain together, those are called your cranium. All together, you can see your mandible connects down here as part of your jaw. And then there is that foramen magnum that's in the middle that is going to connect to your spinal cord. Now your spinal cord is going to be protected by the vertebral column. Your vertebral column is made up of many different vertebrae. Your cervical vertebrae are the ones that are found in your neck, okay? And there are 8 cervical vertebrae. The thoracic vertebrae are the ones that you're going to find in your chest area, and those are 12 vertebrae that come all the way down. And that gives you your normal curvature of the body. Your lumbar vertebrae are your lower back, okay? And you have 5 of those. And then your sacrum is kind of a unique structure. It's 5 bones, but most of those bones have actually been fused together into one. And they come down right at a point called the coccyx. And this one you might need to actually write into your notes. Okay, and the coccyx is what we consider our tailbone. Having a hard time writing this today. There we go. Okay, so your tailbone is right down there, and that's considered a vestigial structure because our ancient ancestors had tails, and we don't anymore, but you know, our ancestors did. Now, part of your chest cavity is your thoracic cage. Your thoracic cage, its job is to protect your heart and your lungs. And the structures that are going to do that you need to know about is the clavicle. The clavicle is your collarbone. Okay. You have your ribs, and there are two different types of ribs. You have true ribs and you have false ribs. Now, that doesn't mean that, they're real and not real. What they're talking about is if you look over here at the sternum is your breastbone, right down the middle, and your true ribs are actually connected directly to the sternum. If you look at each of these points, they're actually connected directly to it. Okay? Now, as you get down to your false ribs, they are not connected directly to it. This blue stuff here is cartilage, and so ribs 7 through 10 actually all connect to each other through a bridge of cartilage, and then they connect to the sternum. And then when you look down here at 11 and 12, those are called floating ribs because they're not actually connected to the sternum at all. They're just kind of hanging out in the back. Okay, so that's why they have these different names for them in your thoracic cage. But the main job there is to protect your heart and lungs. Now, right behind your thoracic cage, you'll find your pectoral girdle. And your pectoral girdle is mainly your scapula, okay, which is your shoulder bone. And then you also have your clavicle up here. And these two bones together are going to give a place for attachment right here for the humerus. And the humerus is your upper arm bone. So if we take a look at the bones of the arm, again, we said the humerus is going to attach at the scapula, at this joint here. So your humerus is your upper arm bone. You ever heard of the funny bone? That's actually a little bundle of nerves right here. And if you hit it the right way, it can cause an awful lot of pain. Down at your bottom, you have your ulna and your radius. Those are the two bones that are at the bottom. Your radius is the one that is on the thumb side of your hand, and the ulna is on the pinky side. Sometimes I try to think of it like the ulna is a smaller word, and it's with your pinky, which is your little finger. You can find some way that you can remember it. Sometimes that one works. Now, these bones are connected down here to your hand, and your hand is made up of basically three major groups of bones. Your carpals constitute all the bones of your wrist, and there are 8 carpals, different carpals. So you don't need to know the names of all the different carpals, but those are those little tiny short bones, not tiny, but they're small short bones that are inside of your wrist. They connect to your 5 metacarpals. So those are the longer finger bones that you have. And then collectively, all of the bones of your fingers are called your phalanges. So your proximal is closest to the point of attachment, and your distal is furthest away. And so your nail would be down at this end. Okay. Now moving down to the lower part of the body, we have the pectoral girdle. Your pectoral girdle has various parts to it, but basically we already talked about the sacrum. That is the bottom part of the vertebral column. These two large bones up here are called your coxal bones. Okay, and that's what gives you that big flat part of them. They've got different kinds of names to them, but that's basically what you need to know. And then you have your pubis area in here. Okay, and this is where the two bones come together. So that's cartilage that's in between. And here you have the sockets where your leg bones are going to connect. So if we continue down to the next part, you have your entire pelvis, right? And there's your hip joint. And these are the bones of the lower limb. So your femur is your largest bone in the body. The patella is your kneecap. Okay. The tibia is the larger of the two bones at the bottom, and next to it is the fibula. So usually if somebody breaks their leg, it's the fibula that they're going to break. And you can remember that one because fibula with the L is the littler one. And then you have your tarsals, metatarsals, and phalanges. So if we look closer at the bottom, at the foot here, okay, you actually have 7 different tarsals that make up your ankle. Okay, that was my son talking in the background there. Then down here you've got your metatarsals. So there's tarsal and metatarsal. So here are your metatarsals. So just like in your hand, they're metacarpals. Now they're metatarsals. And then the phalanges, again, are the bones of your toe. So those are the little bones down at your toe. Okay. So the tibia and fibula come together and they meet up with all of these bones. Now the other major bone down here is your heel bone. That is one of the tarsals, but the calcaneus is probably a major bone of your foot. And that's one that you'll hear about and see in some of the labeling that you're going to have to do. Okay. So here's all the bones kind of collectively taken together. So you're going to see a couple of different diagrams like this as you go through and have to label some bones. But what you need to know is pretty basic, not a whole lot of detail as far as which bones you need to know, because I figure you can probably look that up if you need to. Now, where all these bones come together are the joints, and there's three basic types of joints. The synecrotic joints are your immovable joints. So we saw those in the skull, and where those come together are called the sutures. So we already looked at those. Okay. The amphithoracic are slightly movable. Okay, so they can move to a degree, and your vertebrae are actually considered this kind of joint. You don't have as much flexibility in one vertebral joint as you do with the entire vertebral column collectively. So between just two vertebrae, you're not going to get a whole lot of movement. And then the last set is the diatrophic. Okay, the diatrophic are your freely movable joints. So these are the ones that you probably think about the most. These are the ones that move around all over the place. Shoulders, knees, elbows, all of that stuff. And these ones are all within a capsule that have synovial fluid within them, and they're called the synovial joints. Sometimes you can get fluid on the knee, and that's where you get a buildup of that synovial fluid, and it will cause swelling in the knee. There's also lots of cartilage and stuff in there. Shh. Give me a break. Hold on. Hold on. I'm going to pause for a second while my son is here. All right. Anyway, let's move on. So let's just take a look at the last couple of joints here. So again, here is your skull, which is one of your immovable joints. So this is what the sutures would look like once the bones have been fully fused together. Your ribs and vertebrae are semi-movable. So there's cartilage in there. Like your ribs can move a little bit when you breathe, but they're not freely moving all over the place. Vertebrae are also called cartilaginous joints, and that is because there is a thick band of cartilage right between each vertebrae. And it's that thick band of cartilage that gives them that name and that protects them. And sometimes that cartilage will bulge out. You'll hear about that with some people, and it can be pretty painful. And then a couple of examples of your freely movable. Your elbow is a hinge joint. Your hip is a ball and socket joint. There's saddle joints. There's gliding joints. There's a bunch of different kinds of joints that are in your body. So we'll take a look at all that stuff and some of the work that we're going to do in class.